Child Abuse in Ontario by Jared Negan Friars. Ontario is one of the 13 provinces and territories of Canada. It is located in east central Canada and is the most populated and richest province, accounting for approximately 13.5 million or 38.3% of the country's population. 16.7% of the population in the province of Ontario are children. Child welfare in Canada is a mandatory service that is governed by provincial legislation. Ontario's yearly funding amounts to over $1.4 billion. There are 47 not-for-profit child welfare agencies. Each one of them is a private legal entity funded by the Ontario government. In Ontario, it is the law to report suspected child abuse or neglect. Members of the public and professionals are required to report suspected cases. The Ontario government has created the Office of the Children's Lawyer to make sure children have independent legal representation. Reported cases are immediately investigated. The Canadian Incident Study of Reported Child Abuse and Neglect is the only nationwide study of annual incidents of child maltreatment and the characteristics of children and families investigated by Child Protection Services in the province of Ontario. They look at issues such as poverty, race, and sex trafficking. Recent studies of the Ontario child welfare system have provided cross-sectional reporting of child welfare service involvement. Aboriginal children are dramatically overrepresented. 7% of Ontario's maltreated children were First Nations. This can be attributed to the lasting impact of the residential school system. The residential school system significantly harmed Indigenous children by removing them from their families, ancestral language, and exposing many to physical and sexual abuse, resulting in the increased prevalence of post-traumatic stress, alcoholism, substance abuse, and suicidality amongst Indigenous children. A study conducted in Ontario found that 31% of males and 21% of females experienced physical abuse during childhood. Females experience more sexual child abuse, while males experience more physical child abuse. Emotional harm was found in 20% of cases, resulting in nightmares, bedwetting, or social withdrawal. In a further study of street youth in Ontario's largest city, Toronto, 1/3 of those youths had experienced physical or sexual abuse or both. These abuses have manifest in homelessness, mental health conditions, suicide ideations, and suicide attempts, together with drug use and dependence. Child abuse is one of the most difficult issues one can face. For over 30 years in Ontario, the Canadian Red Cross has been working with schools and communities to spread prevention messages and promote healthy, safe relationships. Sadly, few comprehensive programs are available in Ontario that deal specifically with preventing child abuse. From a public health perspective, these findings reflect the urgent and immediate need and accountability Ontario requires in order to address and make child abuse a priority so that there will be necessary services readily available to victims of child abuse. These services include the need for public education and public outreach.